care, lead, inspire, repeat. Hi, my name is Nicole LaPapa. I'm a staff nurse at the Shirley Ryan AbilityLab, and I also serve as the co-chair for the Skin Champions Council. So what inspired me to become a nurse? Ever since I was young, I was a very empathetic person, and I knew I wanted my life to be in service to others, but I struggled figuring out how I could do that. When I was in high school, I had a couple of knee surgeries, and I spent a lot of time in and out of the hospital where I really got to see the role of a nurse. And there were so many of those nurses who inspired me and showed me such compassion, kindness, empathy, and I wanted to be them when I grew up. When I hear the words care, lead, inspire, repeat, the one that speaks the most to me right now would be inspire. The reason I say that is because in the career of nursing, there are so many ways that I am inspired daily, whether it be from my patients and their families and the resilience that they show, or my colleagues and how they overcome challenges and empower me to be a better nurse. Just even in the age of social media, seeing nurses' stories on social media and how they overcome those challenges and how relatable they are, I want to be a nurse who inspires. I see inspiration daily in my practice, and I want to implement that into my patients and their families' lives. We recently had a woman who suffered a traumatic brain injury. She had a daughter who was about 3 years old, and it was really scary what her mom was going through. And so every day, my colleagues and I, we tried to make the situation a little bit easier for her. And at the end of this day, she came up with a plastic stethoscope and said she was inspired to be a nurse one day, and that's just something that really stuck with me and gave me hope. One moment in my nursing journey I will never forget is actually my very first shift off of orientation without a preceptor. It was a crazy day, to say the least. Everything that could go wrong did. It was very emotional. I remember at the very end of my shift, before I was getting ready to leave, I was proud of myself for getting through it. And I witnessed my first rapid response. And of course, I was the one calling it on my patient. And I remember feeling so scared. And I just knew my preceptor drilled into me, if something goes wrong, hit the emergency light. You're only going to be alone for 10 seconds max. And that's what happened. I hit the emergency light, and my colleagues run the room immediately, and they provided so much support and really helped me get through that situation. I could not have done it without them, and they lifted me up and empowered me. That was a situation, it was my worst fear as a new grad nurse, is when something would go wrong for the first time. And of course, it happened the very first day. So the support they gave me, the compassion, the grace, is something that I will never forget for the rest of my practice, and something I want to provide to my patients and my colleagues. The way that I care for myself while caring for others is reminding myself that you can't provide care if the glass is empty. You really have to invest in yourself. So on my days off, I try and do things that fill me up as a person, surround myself by people who fill me up as a person, and I'm fortunate enough that a lot of my colleagues are the people who do that for me. Mental health is something I think the nursing community really needs to prioritize. And I think that supporting your mental health is a necessity in the healthcare field, especially with nursing. We see a lot of traumatic things, and if we're not caring for ourselves, then we can't care for others. It's just really important to invest in yourself as a person, because then you can be the best in your everyday life and in your professional life. Something about nursing that someone who's not in the profession often overlooks is many people think that nursing is very task-oriented, that we follow orders from a doctor and that's it. But it's so much more than that. We're critically thinking every day. We are the first eyes on the patient. We're often the ones who catch any status changes. We're our patient's biggest advocate. We're the ones who reach out to the team. We're coordinating the care. We are getting to know the patients, their families. We're a part of their journey. We're providing physical, emotional, and spiritual treatment to them. And I think it's just so all-encompassing and holistic, and a lot of people don't realize all that goes into being a nurse.